Clinical Pastoral Education, CPE, is an internationally recognised form of training for pastoral ministry with a particular focus on healthcare ministry. It's a form of adult transformational learning to prepare people for pastoral ministry in all sorts of contexts, but here in Sheffield we've been focusing in particular in the healthcare context as healthcare chaplains. The first pilot unit of clinical pastoral education based here at the Sheffield Teaching Hospitals has come about following a number of years of conversation and exploration, recognising the robustness of CPE, the international recognition of CPE. Clinical pastoral education is preparing healthcare chaplains to be able to provide expert, professional, relational, spiritual, pastoral, religious and cultural care. And I guess if I was a patient, that when a chaplain comes to meet me, I feel that they have connected with me, they meet who I am, they understand what's important to me, and through that help me to navigate the uncertainty of illness, of frailty, or wherever I find myself today. And in many ways, it's person-centred care at its best.
CPE has been delivered in a way where we've worked very closely as a group, different dynamics, different faith backgrounds, and we managed to see things in a different light, sharing the way that we practice.
It's unique because at the very beginning we each share our stories, and that creates a trust in the group.
It's about understanding each other's stories, and in that environment you learn to grow as a person. So it's actually about self-awareness, it's about learning with your peers, the diversity with your peers and the diversity of the people we meet, the people we treat. There's nothing else like it.
So the journey of CPE has really opened up doors for myself in terms of me as a person and my self-identity. It's about being fully present with my heart and my gut to be able to actually see where this patient is on their journey and where best I can support them.
It's clinical professional education. So what it's done is it's taken my chaplaincy work into the context of healthcare.
I would highly recommend this course because it's given me self-confidence in the work that I do and within my role, and it's also enhanced my learning in many ways, whether it's theological reflections, whether it's reflective practice within a team, and just to be able to grow as a person and be able to minister to the best of my ability.
I would fully recommend it as a course which helps you to actually look at yourself and how you actually connect with others, which is core to what a chaplain does.
This CPE course would really benefit the NHS because the NHS is all about person-centred care. If their spiritual and emotional welfare is well supported, then that just improves the whole patient experience.
I'm really pleased that Sheffield Teaching Hospitals has been able to host the first trial of clinical pastoral education in the NHS in England. Chaplains fulfil a really unique role in patient care, and they also make an important contribution to staff well-being. So it's really important that we equip them with the skills and practices that they need to be effective in that role. So it's been great to see clinical pastoral education in action and to understand why it's become a kind of international standard of professional training for chaplains. So what I hope as a result of this trial is that we begin to see CPE being developed in England, that it becomes established by the NHS as core training for chaplains to enable them to continue to fulfil this really important role that they have with us.